Hey guys, this is Trevor Wicken from medxcoach.com. We're on our second video of the lower leg dysfunction series, and what we're going to be talking about today are some muscles in the lateral portion of the hip right here that are going to cause part of the dysfunction. So, as we talked about last time with the lower legs, what we see a lot is because these muscles up here get real tight, these muscles down here get real tight, and you have weakness on the inside here and some of the muscles on the glutes and the hamstrings. What typically happens with most people is they go to squat and stand up, and their knees start to rotate in like this. Remember from last time we talked about the foot rotating out like that, which is why we did the release work on the calf muscle in here and these fibularis or these peroneal muscles in here. Okay, so when we talk about the hip, what happens? We're going to talk about the TFL today, or the tensor fasciae lata, and we're going to talk about the biceps femoris muscle, which is this outer hamstring muscle that you have going on. Okay, so with those muscles being tight, what happens is the whole leg up here, the femur, starts to rotate in like this. And again, because these muscles in the ankle typically are tight as well in this condition, then the shin bone of the tibia starts to rotate out, and we got this big old pain spot in this danger zone right through here. Okay, so what we're going to want to do is we're going to want to release or foam roll this TFL, and then we're going to want to release this biceps femoris muscle using a lacrosse ball in a seated position. Okay, so let's start with that TFL. So the TFL muscle is kind of like the old west, like gunslingers. You got your holster on your hip. Okay, so you're going to feel your hip bone right here and down here. That muscle's right in the middle like this. Okay, so what we're going to do is we're going to grab a foam roller. Okay, and again, if you don't have a foam roller, you can use something like a hard water bottle, like one of those metal Nalgene bottles or the really hard plastic ones. You could use a rolling pin or something like that, or anything that you can actually roll on to bridge the structure. Okay, don't try to use a soft plastic water bottle, or it's just going to be a mess. Okay, so you're going to be on here. What you're going to do is you're going to sit on this first. Then you're going to drop your elbow down. You're going to rotate, and you'll feel if you're on your actual hip bone, okay, or the top of the femur, it doesn't feel good. So you're going to be just above that. What you're going to do is you're going to take your top leg, put it over the top, and then you're just going to kind of find a spot. You're either going to roll forward, you're going to roll backwards, up and down, and I kind of have one about right there. And again, you can rest this leg kind of here, hold the body up nice and tall. So I don't want to see this. If you need to come down, you can kind of come down like that, but you got to be careful of your back. So use this other hand to kind of support you, and you're just going to find a spot and hold that for about 30 to 60 to 120 seconds. So 30 seconds to a minute to 2 minutes, depending on how tender that spot is. Once it starts to dissipate or the pain gets less, then you know you're getting that spot to release. Okay? So once you're done with that, you know that you released your TFL. Okay? So next exercise we're going to be doing is going to release this biceps femoris, or this outside hamstring muscle. So there is a way to do this kind of on the foam roller, but you don't really get much out of a foam roller, okay? It just doesn't get deep enough into those muscle fibers. So what I like to do is use a lacrosse ball, and I'm going to pull my sexy leg up again here. And that biceps femoris, you can see this tendon right here. It's going to be just underneath that, okay? So what you're going to do is you're going to get on a surface like a chair that you can scoot pretty far back. You're going to take this lacrosse ball, and you're going to place it right under that leg. Now this chair is a little short, so what I'm going to have to do is turn my body a little bit, okay, and get underneath. So we're just going to get underneath right here, and we're going to sit up nice and tall, and we're going to kind of just lean forward, and you'll feel that biceps femoris muscle right underneath, right in it, like, because it's right there. So I kind of lean my body this way a little bit, and I can feel it. So ideally, if you can find something that's a little bit taller so your feet dangle, that would be ideal. But most people aren't going to have something that tall in their house. So you may be able to use your coffee table, you may be able to use some dining room chairs, but basically you're going to get that right underneath there, like that, and then you're just going to kind of roll into it, and you'll know when you hit it, because it's kind of like, oh, and you're going to hold that there for about 30 to 60 seconds is typically what I recommend, okay? All right. So last exercise in the series that we have going on is we're going to do another balance activity, okay? So last time, we worked on the standing, just the standing balance, okay? Just standing like this. Now what we're going to do is we're going to go a little bit more to the outside. So we're going to be standing here, and let's say that we just released this leg. I want you to plant that leg and kind of scoop your hips underneath you. Again, finding big toe, little toe, and the calcaneus or the heel bone on that foot. You're going to lift this leg up. All you're going to do is you're going to tap to the side and then come back to center, lightly tapping this toe. Touch to the side, come back to the center, lightly tapping that toe. What that's going to do is it's going to start working on your side-to-side balance while you're using the proper foot alignment, the proper ankle alignment, and then the proper, what's called your femoral or your thigh bone alignment this way, so you start to get better balance, which is going to decrease the amount of stress on your joints. Thank you guys. See you next time.